So our last presenter will be Dr. Ong. Palliative care medicine is an important aspect of our patient care. Today we have the pleasure of Dr. Ong to give us a presentation on this topic. She has experiences practicing in various settings in various states. She has worked and trained in Arizona, New York City, Michigan. She's currently an assistant clinical instructor for the local osteopathic medical school. She's also part of clinical teaching instructor for KP Geriatric Fellowship, KP Family Medicine, and internal medicine residents that rotate through San Bernardino County. She has vast experience. Dr. Ong is the presenter. She's also actively involved in inpatient and outpatient symptom management for patients with serious illnesses, guiding their families and patient on goal of care discussions. She's coordinating care with hospital team and the clinical staff.
Thank you. Hi, guys. Trying to get through some of the technical issues here. I'm trying to get my video on, but it says that I won't be able to share my video. Wonderful. So hi, everybody. My name is Dr. Ong. That was a great introduction from Dr. Shu, so thank you very much. So hopefully today, you guys have heard a lot of speakers and different resources that are available to you guys as you move forward, with your lives. You guys are advocates for melanoma, advocates for future patients, bringing forth like your stories and your experiences to really provide everybody with awareness of melanoma. And so my job today is to kind of continue to provide you with resources. My job today is to kind of discuss a little bit about what palliative care is and what the services are available to you guys out there. I think when you've been formally diagnosed with melanoma, there's probably a wealth of questions that you may have, where do I go? What do I do? How to get this whole process started. When you've been diagnosed, it's kind of, what does my diagnosis mean? I do encourage a lot of my patients, start learning about your disease as you guys have probably done, and you're here as well today to kind of learn more about what's out there. Learning the extent of your cancer, who's involved in the treatment team. It's also important to make sure that you and your loved ones get to know about the disease, possible treatment options, and kind of what the plan is going to look like. It does take a lot of organization, as you may have experienced in the past. It's important to map out your goals for treatment, ask about what the treatment will mean for your daily life. And one of the other things I also encourage my patients to ask about is, what is the goal of your treatment? Is it to prolong your life, delay disease progression, or to manage symptoms? It's a lot of questions moving forward. So, during this process, it can be very emotional, right? Lots of questions, lots of things that you might not have thought about or even considered. It's also hard to navigate this whole maze of healthcare in general. You're going to get lost. You're going to take lefts, rights, turns, get stuck somewhere. And where do you go during that process? From the previous presenters, they've talked about, what resources are available to you guys. How do you navigate this, not only medically, but even through the system in and of itself. So this is kind of where I want to let you guys know that you guys are never alone. Right? This is where palliative care comes into play. And I have a short video here that kind of does a very good introduction of what palliative care is, and I will proceed to tell you a little bit more about that. So hopefully the audio will work on this one.
You are a bridge. It's true, or at least it's a good analogy. When you're healthy, when the bridge is sound, you can handle anything. Cars, trucks, trains, all the bumps of life, no problem. You are set. But if you're facing a serious health issue, something like kidney disease, lung disease, or cancer, the bridge starts to falter, cracks appear, and pretty soon it's hard to withstand all that traffic that includes your own medical treatment. And that's where palliative care comes in. Palliative care is a specialized form of medical care specifically designed for people with serious illnesses. Its main goal is to improve your quality of life by providing relief from the symptoms, pain, and stress that are an inevitable byproduct of both the disease and the medical intervention. In short, palliative care provides support for your bridge. And when a bridge is in trouble, there is nothing better. Now, palliative care, just like construction, is a team effort. It takes doctors, nurses, social workers, and other specialists all working together with your physician to realize that extra layer, the layer that can make all the difference. It's a treatment method that makes sense at any stage of life and at any stage of an illness, because it's never too late to lessen the burden. So, next time someone you care about is facing a serious illness, remember this bridge analogy and be sure to consider the enormous potential of palliative care.
All right, so that's actually a very great video from getpalliativecare.org, which has a lot of additional resources for your local areas and just to learn about palliative care in general. So exactly this word, palliative, what exactly does it mean? The Merriam-Webster dictionary provides a very great explanation. I mean, in the medical term, we think of it as something that reduces the effects or symptoms of a medical condition without curing it. In basic terms, it's to palliate something is to moderate or lessen the intensity of something. So when you're thinking about it, when you're undergoing a melanoma treatment, you know, there's going to be a lot of side effects that may come about, whether that's physical, emotional, mental. This is kind of where palliative care can kind of come into play. As the video has indicated, you know, it's a team effort. It really takes a whole village to take care of you and make sure that we stay on track and to kind of get you all the treatment that you can improve your health condition overall. And so in our medical world, it's an interdisciplinary effort focusing on the prevention and relief of suffering while supporting the best possible quality of life for a patient and their family facing a serious illness. You know, Palliative's team is to help people live as best as they can, how they want, for as long as they have. So we are we're very well trained a lot in symptom management relating to the serious illness, not just cancer, but, you know, in advanced heart failure, COPD, as the video has indicated. I work alongside case managers, social workers that can provide with you with psychosocial support for the families and the patient. Because I have a team, you know, we're able to navigate and get you guys equipment, get you guys what you guys need to direct your care. You know, we do a lot of communication between patients and families because sometimes it's scary to talk about this with your family. You know, how do I tell my kids? How do I talk to my spouse? Or how do I navigate my own feelings to go through this? And so our social workers are very well trained in that area. A lot of it goes back to education and emotional support during this process. And then lastly, we do a lot of continuity and coordination of care. You know, the palliative team, I know that I've talked to several of the cancer doctors, surgeons, you know, to see what's really going on, or, you know, we talk about the patient's cases just to make sure everybody is on the same page. So that's kind of why I like this image, because it really is a fusion of all the levels of care that's involved for you when you get a serious illness. So to kind of, you know, pare it down a little bit more, you know, when you think about your oncologist, you know, that's your key player, right? They're going to be the ones that manage and direct your melanoma treatments. So your treatments may include immunotherapy, where they're a little bit targeted to your own immune system. There's targeted therapy that attacks more of the specific features within the cancer cells. And then there's your chemotherapy, which affects the entire body. The oncologist is also going to be the one that directs whether you'll benefit from radiation, surgery, or if there's any clinical trials that come about, right? That's directly related to the melanoma. Palliative care, on the other hand, you know, we manage a lot of the side effects of the cancer and the cancer treatments. So I'm sure some of you guys have, you know, thought about, you know, what's going to come about. What are the side effects that I may have, right? Surgeries, for example, may result in pain, numbness, tingling, swelling in different areas. Or radiation may produce, ongoing diarrhea, skin irritation, or burning sensation. The palliative team would be able to help you navigate the pain. We would be able to help you with the numbness and tingling, or we define this kind of like a nerve pain, right? If the nerves are damaged during this process. We have a lot of medications and tools that we can help you get through this, to tolerate these therapies so that you can still continue having a good quality of life. I'm sure some of you guys have been through a couple of the immunotherapies or chemotherapies. Those are the side effects above. We focus a lot also on controlling nausea, vomiting, getting you fluids, getting you the right meds on time, or adjusting meds, or telling you how to schedule some of these meds to lessen the burden of your symptoms. Some of you may have experienced loss of appetite, or ongoing weight loss, shortness of breath. That goes through this. And again, it goes back to like my team to help you with the anxiety and depression, or just handling some of the emotions and counseling that you may need during this process. One of the things that I do wanted to clarify is, a lot of patients kind of get confused and they say, isn't palliative care and hospice care the same thing? So a lot of patients are reluctant to seek out palliative care. And I want to tell you that, palliative care is a fairly newer field of medicine. We're trained in palliative care and hospice care at the same time, but not just like the quote says, while all care is delivered by hospice can be considered palliative care, not all palliative care is delivered in hospice. So this chart, there's a lot of words on there. I'm not going to go into too much detail on it, but there are differences. Common questions that I get, from patients are, who can get onto palliative care, or is it right for me? I think it really depends on a lot of what are your goals of care, right? And hospice is more of a Medicare benefit, so that has a lot, all these other things that we can go over, but a lot of you guys, will benefit from palliative care as you're undergoing any active, aggressive treatments or curative measures for your cancer. We have a lot of resources in that case, and it's a multidisciplinary team of providers that can help out. So, kind of moving a little bit forward, I do work with Kaiser. And so there are a lot of services out there, and I'm going to go into kind of where the settings of palliative care may occur. First and foremost, we have a palliative care clinic. So in this case, to really be referred to clinic, anytime anybody has a serious or terminal illness, they can stay in clinic for as long as possible. We will help out with any physical distress or the psychosocial distress. We do have social workers in our clinic. And as long as you can get to our clinic, that's pretty much, anybody can be seen in that case. So what exactly do we do in clinic? We do a lot of active symptom control. So I do follow up with my patients fairly frequently, especially with regards to any nausea, vomiting, side effects of the chemo, or pain management. My social workers also follow up with the patients dealing with the emotional support that you or your family may be undergoing during this process. We do also a lot of advanced care planning, kind of developing a plan A and a plan B, making sure we know who we can and cannot talk to, who we can, who's there for you, who's at home with you, when should I go to the ER, having these plans in place. And we do a little bit of a limited IV rescue medications that may end up saving you a trip to urgent care or the ER, such as giving you Lasix for any of the swelling or edema that you may have, steroids if you have shortness of breath, or giving you some fluids if you're dehydrated or having any nausea or vomiting, or ongoing diarrhea as a result of your treatment, Palliative medicine is also in the hospitals, in which case, again, same criteria. As long as you have these serious illness, we should be able to follow up with you. Any physical distress or uncontrolled symptoms that you may have had that brought you into the hospital in the first place, we can help out with that. So if it's like uncontrolled pain, uncontrolled nausea or vomiting, we work alongside the hospital doctors in that case to manage the symptoms. And if we need to talk about further goals of care, that's something. And then we kind of help with the aftercare. When are you going to see us again? Or when are you going to talk to your cancer doctor or your surgeon or the radiation doctor? We can kind of guide you in that case. There's one other aspect that I kind of get common questions about. This is going to be a little bit more Kaiser specific, where we do have palliative care in the home setting, where patients who have difficulty leaving the home and they have a skilled need, meaning a reason why a nurse should come out to the house more frequently to assess. Usually it's pain and symptom management or medication management in that case. So again, they'll follow up with any physical distress or psychosocial distress, because it really is, a social worker, a nurse, and a physician checking in on you at the home to make sure that you're under control. These symptoms are a little bit more improved because it's hard to leave the home. Palliative care in the home setting, again, this basically they determine the number of nursing visits that come out. Generally, it's about once a week. We do not provide caregiver relief or benefits, though, meaning the nurse comes out and they treat the problem, but they don't stay with the patient 24/7 or anything like that. There's also physician visits. Nowadays, we can also do virtual visits in that case. Due to COVID, but when things die down a little bit, physicians are going back out to the homes to see their patients, and the physician comes out about once every 3 to 4 months as well. And then the nice thing about palliative is that there is a 24-hour number for patients and their families to call if you're having any crisis or uncontrolled symptoms in that case. So, during this whole process, the secret of change is to really focus on all of your energy, not on fighting the old, but building on the new. Our job is to really focus on your quality of life and giving you the best quality of life while you're undergoing the treatments. And lastly, rounding out here, but under palliative care, how exactly do you get into palliative care? We're a consulting service, so basically you can ask any doctor that's involved in your care for a referral for us. We catch patients at mostly all stages of the illness to really give you a nice, well-rounded care, because you are more than just your disease. We got to focus on the mind, the body, the spirit to really have a good quality of life. All right, Dr. Shu, I think that's the end of my presentation there.
Thank you, Dr. Ong, for this outstanding presentation. And that wraps up our presentations for today.